The way we are currently thinking about AI in healthcare is it's a bit like it's we had a physical stethoscope and now we have an AI stethoscope and we're just going to take one out and plug the other one in. AI is much more like a systemic level transformation of the system because it can provide us with new insights into things that we didn't know before. It can put together new forms of symptoms and say, oh, we used to think that a diagnosis of this particular condition required these 5 symptoms, but now we understand that actually it requires only these 3 symptoms or these completely different symptoms that we never understood. So it can re-ontologize what we consider to be a disease or what we consider to be a disability by reconfiguring the different components of something that goes into that. It also allows us to flex and play with how you organize care. The simplest one, a way of understanding that, is now we have access to clinical knowledge that doesn't necessarily need to sit inside a clinician's office. So we can have people being diagnosed completely remotely and never need to be inside a clinician's office if that is possible based on the thing that they need to be diagnosed. So we have this enormous amount of flexibility now where we can sort of rethink how you distribute care, what care even is, and what it means to be healthy. And that can be incredibly powerful and incredibly positive, or it can be dangerous if we aren't thinking about the end goal. So that's really what I mean by re-ontologizing. If you ever hear Luciano Floridi, who runs the center, he talks about this ability to cleave, the cleaving power of the digital. So it's a power to cut and paste together different concepts. So the easiest one there is cut and paste, or sort of separate the clinician and the clinic. But it also, another one that I talk about more often is you're separating diagnosis and treatment and prognostic decisions from the patient themselves. You were no longer touching or dealing with their physical body, you're dealing with a sort of data representation of that patient. So you are separating them. So that cleaving power gives this power to completely redesign the way in which we deliver healthcare, which is why it has the capacity to re-ontologize what we mean.